Okay, good morning, Harborne Hill.
Good morning.
Have you enjoyed your sessions to introductory microbiology so far? You had some fun? Yeah, excellent. Okay. Well, today is fun too. We've got some more fun things lined up for you this afternoon. But for the next 20 minutes, okay, I just want you all to give me 100% attention, okay? Listen to what I have to say, okay, because this is really important stuff. I'm going to talk about sexually transmitted infections, all right? These are infections that can infect anybody and they can be passed on very easily, okay? So 100% attention, yeah? Do I have your agreement on that? Yeah. Okay. Just to reiterate what Dr. Brown has said so far, there will be some images in here that may be offensive to some people, okay? Maybe a little bit disturbing, but this is the real world, okay? This is microbiology and this is what organisms do to us, okay? So bear with it, pay attention and learn from it, okay? So what I'm going to do for you today, well, I'm going to tell you what sexually transmitted infections are, okay? Give you a bit of background to them, and then tell you about 4 important infections: chlamydia, genital warts, gonorrhea, and HIV and AIDS, okay? Tell you a little bit about those, be a few images there for you to see just what these things look like, but more importantly, perhaps at the end, how you protect yourself against STIs, how do you prevent them, okay? Because prevention is better than cure, and STI is probably one of the most easily preventable infectious diseases that we know, okay? So what are sexually transmitted infections? Okay, basically, they're infections that are obtained through sexual contact, okay? And when I say sexual contact, I don't just mean vaginal sex, okay? This can be anal sex, oral sex, or even the use of sex toys, such as vibrators, okay? And even, in some cases, kissing, okay? Not all sexually transmitted infections, but some can be passed on through kissing as well, all right? So they're very easily spread. They're communicable diseases, okay? Just like the superbugs I told you about yesterday, sexually transmitted infections are communicable diseases. They are passed very easily from person to person, okay? They're highly contagious, passed very easily. And probably, unlike most other infections, they're caused by all the major groups of microorganisms, okay? Such as the bacteria, the viruses, the fungi, okay? Parasites, and the arthropods, such as lice, okay? So all these organisms can cause sexually transmitted infections. Sadly, STIs, as I'll call them from now on, cost the NHS around about £750 million a year, okay? That's a lot of cash spent on treating a very easily preventable disease, okay? Treating, diagnosing. That money could be spent on far better things, okay? Just like the superbug infections I told you about yesterday. Cost the NHS £750 million per year. Who can get infected? Basically anybody, you, me, everybody, okay? But predominantly, STIs occur amongst younger people, let's say 15 to perhaps 35 years of age, okay, with perhaps a more promiscuous lifestyle, perhaps you're trying out new partners, having new relationships, etc., okay, giving organisms a chance to spread from one person to another, okay, so younger people, just like you and me, okay, and also these days, okay, a term which I want you to become familiar with is MSM, okay, men who have sex with men, okay. This is a more common practice these days, and over the last 20 years, the number of MSM has increased significantly, okay. So these are the 2 major groups of people, patients, whatever, that are more prone to STIs, okay. We also call STIs the silent epidemic, okay. That's worrying because most people, or a lot of people that have STIs don't actually know they've got one, okay? So you may have a relationship with a partner and contract an STI and not know you've got it, okay, because you don't have any symptoms. So what do you do then? You may go and have sex with another partner and pass on the infection because you don't know you've got it, okay? You are a reservoir of infection, which is why we call STIs the silent epidemic, because as well, over the last 10 years, there's been a 63% increase in number of STIs. That's a lot in a decade, okay, because a lot of people just don't know they've got them, all right? Can they be treated? Well, yes, some of them can be very easily treated, okay, such as chlamydia. If you know you've got chlamydia, and a lot of people don't, as I've already said, a short course of antibiotics will cure your chlamydia, and then you won't pass it on to anybody else, all right? Some infectious diseases, the STIs, cannot be cured, okay? The major one here is HIV and AIDS, okay? You can control it to a point, but you can't cure it, all right? So far, so good? All right. All right, so I'm just going to skip back one slide here and give you a brief insight into that. But if you were listening at the beginning, I told you about 4 STIs that I'm going to talk about today. Can you put your hands up and tell me any STIs that you might know about? Any ideas? What? Sorry? I'm sorry, I can't hear you. Gonorrhea, okay. Any more? I've told you 4 already, come on. Gonorrhea. Chlamydia. Herpes, good. HIV. Thrush, yes. Sorry? Genital warts. AIDS, okay, they're all coming out now. The waters are flowing, okay. You're right there, but believe it or not, there's something like in excess of 25 different sorts of STIs that we know about. And these are the most common ones, most of which you've covered already, okay? So chlamydia, we've had that, genital warts, herpes, gonorrhea, thrush. Okay, thrush doesn't have to be sexually transmitted, okay, but it can be. Syphilis, okay, we didn't get that one, but syphilis is very common these days as well. HIV and AIDS, and hepatitis B and C, which is a blood-borne infection which you can get through transmitting or through drugs and through sex as well. And also crabs, pubic lice, okay, but there are many more than that. Is that surprising to you? They're in excess of 25? Yeah, okay. Okay, so should we take a look at a few of these STIs? Yeah? So you ready? This is our little STI mascot for today. This is our, it can be chlamydia if you wish, okay? So get ready, folks. So what do you fancy a bit of? A bit of chlamydia? A bit of gonorrhea? Okay? And let's take a look at chlamydia first. Okay, here we go. Okay, well, chlamydia is caused by a bacteria, okay? It's caused by a bacteria called Chlamydia trachomatis, okay? How many cases do we know about in the UK? We know about 114,000 new cases every year. Okay, these are people that are presenting with symptoms. These are people that go to their doctor because they're actually showing symptoms, okay? Around about 114,000 cases. What's that? Probably the size of the Millennium Stadium, something like that perhaps, okay? And over the last 10 years, there's been a 166% increase in chlamydia. This is because we call chlamydia the silent epidemic because a lot of people just don't know they've got it, okay? It's estimated that 1 in 10 sexually active people, let's say between 15 and 30, carry chlamydia and don't know they've got it, all right? How is it transmitted? Well, it can be transmitted through vaginal, anal and oral sex, and it can also be transmitted from mother to baby. So if the mother has chlamydia in her cervix, okay, she may not know she's got it, but it can be transmitted to her newborn baby, okay? What about symptoms? Well, most cases, probably around about 50% of males and females don't know they've got chlamydia, okay? So they'll go around happily transmitting it to other people by having different sexual partners. If you do have chlamydia and you know because you have symptoms, what sort of symptoms do you get? Okay, well in women, you can get inflamed vagina and vaginitis, we call it vaginitis, and also cervicitis, which is inflammation, infection of the cervix, okay? In men, you can have a penile discharge, okay? The discharge is usually quite watery, a bit mucoid, okay? And in babies, if it's transmitted to babies, then they tend to be born with conjunctivitis, very sticky eyes, okay? So these are the sort of symptoms that we see. Worryingly, chlamydia can cause infertility in men and women, okay? If it's not treated, if you don't know you've got it and it's not treated, chlamydia can go into the fallopian tube and cause infertility, into the testes and cause infertility in men as well. So it's probably best that you know you've got it, okay, or else at least get yourself screened for it. Can it be treated? Well, the answer is yes, it can. It can be very easily treated with a short course of antibiotics, okay? Usually a tetracycline called doxycycline, or these days an erythromycin antibiotic called azithromycin, okay? So that's a bit about chlamydia. Do you want some more? Okay, genital warts, okay? Genital warts is the second most common sexually transmitted infection in the UK. Chlamydia is first, genital warts is second. Okay? Genital warts is caused by a virus on this occasion, and it's called the human papillomavirus. Okay? Have you heard of human papillomavirus at all in any other circumstances? Anybody? The human papillomavirus is the the human papillomavirus, HPV, is the virus that causes verrucas and warts on your hands. Okay, so it's the same sort of virus that causes those. But two sorts of virus within the group of HPV, types 6 and 11, are the most common types that cause genital warts. Okay, and we see in the UK around about 84,000 new cases every year of genital warts. And again, just like chlamydia, it's transmitted through vaginal, anal and oral sex. Okay, but worryingly, again, with HPV, is sometimes it can take up to 6 months after contact before you actually know you've got it. Okay, so it can take half a year before symptoms actually show. What are the symptoms? Okay, well, in men, okay, and women, you tend to get very numerous dry warts, a little bit like this here. Okay, they look a little bit like a cauliflower, a small dry cauliflower. Okay, and you get them in the vaginal area, on the penis, and also around the mouth. Okay. The sad thing about HPV is that two types of HPV, types 16 and 18, can actually cause cervical cancer. So a very simple virus can lead to cervical cancer. Okay, and these are types 16 and 18. Okay, these types, they tend to cause genital warts as such. These types will cause cancer, cervical cancer. Okay, can you treat it? The answer is yes, you can. Okay, if you have genital warts, okay, go to your doctor and he will give you, or she will give you anti-wart cream, okay, which you can apply to very superficial warts. If the warts are very deep, okay, sometimes they may need to be frozen out. Okay, but these days there is a vaccination campaign, okay, through the NHS, which was implemented last year in 2008, whereby girls between the ages of 12 and 13 can be vaccinated against these two types of HPV, which cause cervical cancer. Okay, so if you haven't been vaccinated, you can be vaccinated, okay, with a vaccine called Cervarix. Okay, and if you're interested in that, then maybe you can go and see your GP about that. Okay, that's genital warts. Some more? Okay. Okay, gonorrhea. Okay, we've all heard of gonorrhea. It used to be called a clap, and it still is called a clap in some cases. This is actually caused by a bacteria called Neisseria gonorrhea, and this is the little chap up here, a little kidney bean-shaped organism. Okay, Neisseria gonorrhea. Gonorrhea is the third most common sexually transmitted infection in the UK. Okay, and we see around about 19,000 cases every year, and that represents perhaps a 46% increase over the last 10 years. So all these STIs are still increasing on a yearly basis. Again, like most others, it's transmitted through vaginal, anal and oral sex. Okay, and it can also be, just like chlamydia, transmitted from mother to baby. Okay, so if you have gonorrhea in the cervix, then it can be passed from mother to baby. Okay, what are the symptoms? Again, just like chlamydia, a lot of people don't know they've got gonorrhea. Okay, so you can be walking around passing gonorrhea on to your new partners, okay, not knowing that you've got it. If you do have symptoms, okay, the symptoms tend to be, in the male and female, very thick, what we call purulent, lots of pus in there, discharge from the penis or from the vagina. Okay. In the babies, okay, tend to have eye infections such as conjunctivitis when they're born, and gonorrhea is one of these organisms that can cause, just like chlamydia, can cause infertility So it can descend into the testes and cause infertility in males, or rise into the fallopian tubes and cause infertility in females. Okay, so we need to treat it. It also causes blood infections occasionally. If you're a very poor patient with a very poor immune system, gonorrhea can get into your blood and infect your joints as well. Okay. Can it be treated? Yes, it can. Gonorrhea can be treated, okay, with a penicillin type of antibiotic, a group we call the cephalosporins. Okay, it can be very easily treated if you know you've got it. Okay. HIV and AIDS. Okay, the last one we're just going to talk about today, caused by a virus, the human immunodeficiency virus. Okay, and this is a virus which can lead to a condition which we call AIDS, which is the acquired immune deficiency syndrome. Okay. In the UK, we know there's around about 90,000 HIV positive people in the UK. Those are people that know they've got HIV, okay? But there's around about 30% of people walking around there with HIV because they lead a promiscuous lifestyle that don't know they've got it. So they're happily passing it on to new partners, okay? And we see round about 7,000 cases, new cases every year. And that represents something in the region of perhaps 188% increase in HIV over the last 10 years. Admittedly, the majority of new cases is in the MSM group, okay? That's men who have sex with men, okay? Transmitted through vaginal, anal and oral sex, just like any other STIs. We can also acquire it through injecting drugs, okay? Intravenous drug injection. And it can also be passed from mother to baby. So newborn babies can acquire HIV from HIV-positive mothers. Okay. What are the symptoms? Well, if you come into contact with a HIV-positive person, you acquire HIV, the symptoms can be very mild to start with, a bit like a cold. Okay. You may have a sore throat, okay, rash, perhaps some night sweats, some swollen glands in the neck, under the arms. Nothing too spectacular, really. Okay. A little bit of weight loss perhaps. But as the organism progresses and grows in your body, it starts to destroy a major group of immune cells called the CD4 cells. Have you heard of these at this stage yet? The CD4 cells are a very important white blood cell that can kill viruses, okay? And this organism breaks down the CD4 cells and depletes your system of these cells. So over years and years and years, you get less and less and less of these cells. So therefore, your body can't fight infection. Okay, so what happens? Your body basically becomes susceptible to very minor infections that are minor to us, okay, but not minor to HIV people because they cannot fight the infections off. So down here, for example, this is oral thrush, okay. Oral thrush is very common in HIV people because they just cannot fight the fungal infection off. We have thrush in our mouths commonly, but we don't know we've got it because our immune system keeps it in check. These people, it doesn't happen. Okay, so they can come down with oral thrush, a whole range of other infections which will eventually kill them, okay, and also various skin cancers which we call Kaposi's sarcoma. Okay, but this is towards the very end stage of AIDS, which may be something like 10 or 20 years. Okay, can it be treated? Well, no, it can't. At the moment, there's no cure for HIV. Okay, we can give antiviral drugs to patients which will control the infection and try and keep the infection at bay and stop it progressing. Okay, but we can't as yet cure it. So if you become HIV positive, you will be HIV positive for a long time. Okay, until eventually you'll probably die. All right, so. Okay, so let's just round up. Okay, here's our little STI fellow again. Okay, it's chlamydia. Okay, don't you want your baby there? Okay, so just remember, I'm easily passed around. Okay, you may not know you've got me. Okay, your partner may be infected. Okay, and not know that they're infected. I can cause nasty symptoms if I wish. Okay, I can also make you infertile. Okay, and worst case scenario, I can also kill you. All right. The simple thing is, they're so easily preventable. Okay, STIs are very, very easily preventable. Okay, and if you take home nothing more today, then take home this slide with you. Okay, STIs can be prevented through abstaining from sex. Okay, cutting it out completely. Okay, that may not be the preferred option. Okay, we are humans after all. Okay, but abstinence is the only sure way not to catch an STI. Okay, perhaps a more acceptable way is to use a condom during sexual activity. It's not rocket science, is it? Okay, use a condom because this prevents the transmission of bodily fluids from one patient to another. Okay, remember, you may not know you've got an STI. Okay, but a condom only protects the skin it covers. Okay, so if you put one on, put it on well. All right, because if you've got warts, okay, and the condom doesn't cover the warts, then warts can still be passed on. If you're in a relationship with a new partner, okay, and you don't know their history, talk to your partner, all right? It shows a sign of maturity, okay, and you're both adults, and discuss the preferences, your sexual preferences between each other, okay? Go and get yourself tested at an STI clinic, find out if you have an STI. And if you don't, if you're both clear, as they say, then you can discuss your own sexual preferences thereafter. Okay, and it's also very wise, even if you know that you haven't got an infection, perhaps to go and get yourself checked every now and again, just to make sure you're still clear. Okay, very simple steps to prevent a very serious group infections. All right, has the message got home there? I think that's actually all I want to say. Are there any questions on STIs from anybody, or has that stunned you into silence? Okay.
If you cut off your genitals, what happens then? Are you still affected?
I'm not sure I can answer that one actually. If you cut off your genitals, will you become infected? Probably not, but I wouldn't like to try it. Okay. Any serious questions? No questions at all? Okay, in that case, I'll stop. Okay, Julia?